Assalamu alaikum and welcome back to Pharmacy Notes. Today our topic of discussion is clinical pharmacy. In this video we will discuss introduction to clinical pharmacy, its definitions, its importance, and also what is the scope of clinical pharmacy. So without wasting any time, let's start the video. First of all, we will discuss introduction to clinical pharmacy. In this slide we will discuss what is clinical pharmacy. Clinical pharmacy is basically a branch of pharmacy focused on patient care. So the main focus of clinical pharmacy is on patients when compared to other branches. If we say the community pharmacy, where main focus is on dispensing of medicines, and similarly the other branches, if we compare the pharmaceutical industries, where the main focus is on manufacturing of the medicine. But in this clinical pharmacy, the main focus is on the patient care. Involves direct interaction with patients and other healthcare team. In this, the pharmacist is in direct contact with the physicians, other nurses, all the other staff, and the healthcare team in which he works for the drug therapy for the patients. And main aim here is to optimize medication therapy and promote a good health for the patients. When we come to a definition, clinical pharmacy is area of pharmacy concerned with science and practice of rational medication use. So what is rational medication use? Rational medication use means that the patient receives the right drug on the right time and in right dose. So patient works directly with doctor, nurses and patients. So how does the pharmacist work with the doctors? Pharmacist works with the doctors in a sense that in making the medication plan for the patients, in which he discusses with the doctor which medicines should be given and which should not be given, and on the basis of interactions or on the basis of which can be more beneficial for the patients. And with nurses, he works on how the medicine should be given to the patients, on which time and in which dose. And when it comes to the patient, and here the responsibility of pharmacist is to counsel the patients on taking the medicines, and he should also guide the patients how they should take the medicines and on which times they should take. So the main goal of the clinical pharmacy is to promote safe, effective and economical drug therapy. Safe means that there should be no possible drug interactions or any other interactions, and effective meaning that the patient should get maximum benefit out of it. And when it comes to economical drug therapy, we all know that there are multiple brands of single salt or the single pharmaceutical ingredient. So it is responsibility of pharmacist to prescribe such brand that not only provides the maximum health benefits to the patient, but it is also economical, so the patient can afford easily. Then coming to the role of clinical pharmacist, its main role is review and monitor medication therapy. So the main role of pharmacist is that he should review and monitor the drug therapy. Reviewing means that when the medicines are prescribed, before dispensing to the patients, he should review and monitor if there are any possible drug interactions or any other interaction that can affect the patient. And when the medicines are given to the patient, then it is responsibility of pharmacist to continuously monitor the medication therapy, so to observe that if the patient is getting the desired outcomes of the medicines or not. Prevent medication error and adverse drug reactions. So before dispensing medicine to the patient, it is responsibility of pharmacist to verify the prescription and check for any drug interactions, or if there are any other drug or any other interactions, like if there can be interaction with food. So he should also guide that, or he should also inform the physician or the one who is prescribing the medicine, and also should explain it to the patients. And the adverse drug reactions. So if there are any possible adverse drug reactions, it is responsibility of pharmacist to identify that and resolve them. and provide drug information and counseling to the patient. As discussed earlier, it is responsibility of pharmacists to provide information to patients that how the drug should be used and what could be the possible interactions. It is responsible of pharmacist to tell. For example, if a patient is taking some medication, and due to, as we all know, that they are majorly medicines are eliminated through the kidney in the urine. So if let's say the color of urine changes to yellow, so it is responsibility that pharmacist must know that this can be the side effect of the medicine, and if it is it is not a you can say that a side effect or not an adverse reaction, so he should tell the patient that it is not a worrying sign for him, so this can happen, so they don't have to take any tension on that. And next is collaborate with healthcare providers for better outcomes. As discussed earlier, it is a pharmacist works with the physicians in making a plan, and then other nurses and other paramedical staff in implementing that plan, and at the end in patients on counseling them for the right use of medications. What are core activities that are performed in clinical pharmacy? First of all, patient medication reviews, as discussed earlier, that it is responsibility of pharmacists to review the medications. Therapeutic drug monitoring, also known as TDM. Basically, it is important for such drugs like phenytoin, etc., in which there is margin of safety is less, and there are chances of drug toxicity and adverse drug reactions. So it is a role of pharmacist comes here to properly guide the patients on the use of medication, and specifically on the dose. Drug interaction check, it is responsibility of pharmacist to check the drug interactions in the prescription if one drug reacts with another. So pharmacist has to identify it. Individualized dose adjustments, so it is also the responsibility of pharmacist to calculate the dose for the patient, that what is the appropriate dose, or what is the need of the patient of that drug. He should calculate the dose based on different formulas, and depending on its age factor and its body mass index. Participation in clinical rounds, so pharmacist also participates with the physicians and other doctors in clinical rounds. These two branches, when clinical pharmacy and hospital pharmacy, they are quite interlinked, so there is a difference between them, because clinical pharmacy is also mainly focused in hospital, and hospital pharmacy, as name indicates, it is also in pharmacy, it is also in hospital, so there is a slight difference which should be identified. Clinical pharmacy is patient oriented, where the main center of orientation is patients, where the pharmacist counsels or implements the plan of medication, whereas hospital pharmacy is the main focus is on product and dispensing. They mainly focus on the medicine that are available in the pharmacy of hospital and on the dispensing. Clinical pharmacy mainly focuses on drug patient interactions. It mainly focuses on drug patient interactions, limited or no, whereas hospital pharmacy has limited or no direct contact on the interactions. So clinical pharmacy is involved in therapy plans, whereas hospital pharmacy is mainly focused on managing supplies and inventory of medicines in the hospital. So why is clinical pharmacy important? So it improves patient safety, it minimizes the adverse drug reaction, so making a possible benefit of the prescribed drugs, enhances therapeutic outcomes. It also reduces the healthcare costs, as I already discussed, that multiple brands are producing the same drug, so the one which is economical should be prescribed to the patients. Builds trust between patients and the pharmacists. So what are career scopes in clinical pharmacy? Hospital and healthcare centers, they majorly need the pharmacists for the medication reviews and patient counseling and all the things. Clinical research organizations also need this. Academia and teachings, where courses of pharmacy are taught, and clinical pharmacy is a subject, so it is also in career scope. And pharmaceutical companies, where research and in R&D and pharmacovigilance, they also work on ADR monitoring, and government and regulatory bodies. Thanks for watching. I hope this small video will provide you much information. So if you have any other question, please drop your question in comment section. I will answer your questions. So if you like the video, please subscribe the channel and share the video with your friends and other families. Thanks for watching. For next time, goodbye.